Today's guest doesn't need any introduction. We have legendary Dr. Mukesh Bhatia sir with us. Entering into the MBBS, things go here and there, and maybe sometimes we can get failed as well. So, has such incidences happened with you?
In fact, this happens with everyone. You got 2 out of 10. Fail! That fail was not in our dictionary. My father was very strict. अगर आप क्लास में फर्स्ट नहीं आए हैं तो ही विल नॉट साइन द रिपोर्ट कार्ड. तो मेरे घर वालों ने इंजीनियरिंग में मेरा एडमिशन कर दिया, फीस भी जमा कराए. मैं कहा जी मैं नहीं करूँगा. When I passed my MBBS, in those days our financial conditions was very bad.
What advices you will give for the medicine students to flourish in their practice? What key things that you have learned throughout your career that have you got from the influences you had?
Very good question. They called me. Means क्या करते हो? What do you do? Practice. Everybody started laughing at me. अब इसको क्या आता होगा? The moment I finished the HOD surgery, looked at me. Nobody can fail him. Not only in MBBS, in MS also. Nobody can fail him. That was a turning point of my life.
Sir, who is your favorite singer?
Even I also sing.
Sir, can you please?
Pakka.
Yes, sure. Wow, so amazing. Your voice is amazing with all the experiences you just shared with us. It's, I think, rather than just a podcast, it's a life lesson for all of the viewers as well as for me as well. And it completely took out a different personality of myself when I listened to you.
Dr. Mukesh Bhatia is also a proud father. Dr. Nachiket Bhatia recently gifted him Rolls Royce and setting example for all of us.
Hello everyone. So today's guest doesn't need any introduction. We have legendary Dr. Mukesh Bhatia sir with us. He is a pioneer of Indian medical education, starting to educate all of us through the medicine since last 30 years, and he is the founder of esteemed DBMCI. And currently, for helping many students cracking MRCP, USMLE, and even NEET super-speciality, he has started Dr. Bhatia's Academy. Not only that, he is the author of Mini Harrison, and he's awarded by so many institutions for this multiple authorship. So today we are fortunate enough, sir, to have you in this platform.
Thank you for inviting me to talk to you.
Yes, sir. So the theme of the podcast is Beyond the White Coat. We all have known you since last 50 years. You have given so much to the medical stream per se. But many few must have known about your childhood. So would like to learn about that were you a mischievous guy or very serious guy? Please tell us about your childhood journey.
Good question. Well, I belong to a lower middle class family. तब की बात है. And just like all the struggles that we have to face in our childhood, but with the guidance of my parents, to be more precise, my father was very strict. अगर आप क्लास में फर्स्ट नहीं आए हैं तो he will not sign the report card. He was not कोई educated नहीं थे, just the usual elderly people. But his strictness, which that time हम कहते थे यार क्या है, but today I feel कि उनकी strictness की वजह से मैं यहाँ बैठा हूँ. Well, उसके बाद I was scholar throughout my school life. हर क्लास में फर्स्ट ही आता था. 6th क्लास से 11th क्लास तक हमारे टाइम में 11th क्लास होती थी. अब +12 हो गया, +2 हो गया है. आई वॉज स्कॉलर, बल्कि 6th to उनका 8th क्लास तक तो मुझे डबल स्कॉलरशिप मिलती थी. एंड आई वॉज वेरी क्रेजी अबाउट मेडिसिन.
How you got this interest?
मेरी भाभी के एक भैया थे उस वक्त, डॉक्टर रमेश भाटिया. ही वॉज आवर फैमिली फिजिशियन ऑल्सो. And I was very much inspired by him. यार क्या रोब है, क्या इज्जत है. तो एक यू कैन से एक रोल मॉडल मिल जाता है आपको. तो मेरे मन में मेडिसिन घुस गई. जब मैंने, और इनफैक्ट मेरे 2 बड़े भाई ऑलरेडी MBBS कर रहे थे. when I passed my 11th class. हमारे ज़माने में हर को बायोलॉजी लेनी होती थी 11वीं 9th 10th 11th में. 11वीं के बाद यू कैन गो डायरेक्टली टू इंजीनियरिंग ऑल्सो. Biology student can go to engineering, but engineering student cannot come to medical sciences. तो मेरे घर वालों ने दिल्ली कॉलेज ऑफ एडमिशन का इंजीनियरिंग में मेरा एडमिशन कर दिया, फीस भी जमा कराए. मैं कहा जी मैं नहीं करूँगा, मैं नहीं गया. और हमारे टाइम में प्री मेडिकल होती थी, तो मैंने प्री मेडिकल ज्वाइन किया. एंड उसके बाद आई केम टू मेडिकल साइंसेस. आई गॉट एडमिशन इन मौलाना आज़ाद मेडिकल कॉलेज, प्रेस्टिजियस कॉलेज. तो ये जर्नी थी हाउ आई एंटर्ड. तो यहाँ तक एंट्री तक का जो मैं कहूँगा क्रेडिट गोज टू डॉक्टर रमेश भाटिया. ही वॉज द रोल मॉडल.
Sir, more than this, as a student, as multiple students follow you, you are like a god for them in medicine per se. So they want to know about Dr. Mukesh Bhatia, sir, that what kind of child, other than studious he was, like what were his hobbies in this childhood, and if not medicine, what he would have been.
मैंने पहले कहा था there was nothing other than medicine.
All-time scholar.
I was a deep love with मेडिकल साइंसेस. है ना, मोहब्बत वो होती है जो दिल से की जाती है. ठीक है जी. तो हमारी मोहब्बत मेडिकल साइंसेस से दिल से थी. आप खुद सोचो, इंजीनियरिंग कॉलेज में एडमिशन हो गया, और दिल्ली कॉलेज ऑफ इंजीनियरिंग में, किसी छोटे मोटे में नहीं है, और लोग छोड़ के भागा है, बंदा मैं गया ही नहीं. तो दैट शोज डीप लव विद दिस थिंग. सो आई एम वेरी प्राउड. आई एंजॉय माई वर्क, आई एंजॉय माई profession. ऐसा बहुत कम लोग कहते हैं.
That's very important point, sir, that you were so focused since start of your career, and currently there are so many distractions for the many students. So that's a good learning point for everyone. So now let's come into your MBBS era. Once we enter into the MBBS, we already have different kind of attitude. We are already scholars throughout our schooling days in the high school, PMT topper. Entering into the MBBS, things go here and there, and maybe sometimes we can get failed as well. So has such incidences happened with you?
In fact, this happens with everyone. We cannot deny it. There's a reason. Once you enter the medical college and you are in first prof, anatomy department, half batch is given upper limb to dissect and the half batch is given lower limb to dissect. Ragging not over. And there comes your first test, what they call as part test, some call it a stage, vagara vagara. Okay, you are not even accustomed to the medical college environment. You see and remember, most of the people, rather everyone who come to medical sciences, they are the school topper. Now you go, you do your test, and the very next day you go to the notice board of the anatomy department. And you see like this, because your name was always on the top, so you see like this. You got 2 out of 10. Fail. That fail was not in our dictionary. First time we get a shock of 440 volt. This is for 99.9% student, I can say. Why? It's a very serious question. School level was this, and the medical college level is like top ceiling. Huge gap is there. Nobody told us how to study. And every day, every alternate day, we see in the newspaper some tragedy is happening. Very bitter, but it's a truth. Okay. I don't know whether I should speak about this or not, but it's a forum where we can really tell, we can help the students. And I will tell the education policy makers of India that this is a big bottleneck for all the students. They should design how to study this, they should guide, okay, so that we are stress-free. I have a very famous content and lecture about this also. Anybody wants, I can definitely guide them how to avoid stress. Whenever I take a class, I say, how many hours a day you should study? People say 10 hours, 14 hours, 15 hours. I say 1 hour. Ha, ha, ha. People laugh at me. But after 1 hour of session, they say this is possible. This lecture I have taken in IES Institute, CES, CA, so many institutes I have taken this lecture. And after 1 hour, I get a standing ovation for 7 minutes everywhere. Yeah, this is the one thing they always wanted. So this, anyway, I also had stress. Somehow we cleared the exam. And now once you are MBBS, you are out. Well, when I passed my MBBS, in those days, our financial conditions was very, very bad. As a male person in the family, our primary duty is to earn the money. This is universal truth. This is not the liability with the ladies. This is good also. Well, our financial condition was very bad, so I started immediately after my MBBS internship. And in our days, there used to be house job also. And after that, there was PG entrance. But now the house job is abolished. Now PG entrance is after internship only. It's a good also. That means now in the post-graduation, now they get 3 years. In our time, it used to be 2 years. 1 year already you are done in house job. But house job you can do in any department. Anyway, that's not a topic of the day. I started practice in a suburb area in Delhi. Rampura is quite near to Keshavpuram at the moment. I started practice, general practice. And I used to do practice 7 days a week. 9 to 1, 5 to 9, 7 days a week. Because there was shortage of money. Now, then the financial condition was so bad. I joined a nursing home as a resident medical officer, RMO also, 7 days a week. 9 to 1, go to home. Then 5 to 9, go to home, have dinner, go to nursing home, come back in the morning, then take breakfast, come to clinic. Can you believe it? I worked for 22 months at a stretch, 630 days. And I left the job just 5 days before my marriage. And whatever salary I got from nursing home, with that, my marriage was done. That shows that there's no shortcut to hard work. I'm a very ordinary man, but there's a huge struggle which nobody has seen. But during this, something very good also happened. Soon, when I started practice, I had to attend one function. In that, my 8 to 10 batchmate were standing. And one of our professor, Dr. G.D. Gupta, joined us. He asked a question, some medical question, which none of us out of 10, nobody could answer. Then he said, don't you read? We said, now we are doing practice, why should we read? No, you should study also. You should study daily. When he went away, out of all the 10, 9 people laughed at him. Just see the professor. Inki professory jati nahi hai. Har jagah they keep on showing their professory. But I was the one person, no, he's saying right. He's right. And I started studying. In my clinic, the book was always open. Not that every time patients are there. I was reading, patient come, okay, see, again I start reading. Nursing home, when I was there, I told you, I always carried my book. Okay. I was always updated. I used to attend conferences of IMA, Indian Medical Association, and Delhi Medical Association. And I always used to go fully prepared. Suppose somebody is talking about thyroid. So I'll read anatomy, physiology, patho, pharma, everything A to Z about thyroid. Definitely when you have read everything, you will understand better. Usually, sorry to say this word, people normally come to these conferences just to have a fun, have a dinner or wine shine. Okay. If there is only dinner is there, 200 people will drinks, 300 people. Sunday morning, 5 people. Me, 1 young man, and 4 Buddhas. Out of 2 old men, they were sleeping, and the other 2 are talking. But I was taking down the notes. But now you'll be surprised why I'm talking about this. It's such a good length. Well, it was 23rd January 1991. One of my friends, senior friend, Dr. Ashok Mittal, he came to me. He said, "Yaar, I got MD." MD? I got PG. I got admission PG. PG? Exam to this happened in March. PG enters. No, yaar. There's a DNB seat has come in St. Stephen Hospital in Delhi. There was an interview. I got selected. Tomorrow again there's a Viva. You also come. Okay. I said DNB. People know everybody, but that time nobody knew what the degree is. I said, is it recognized? Yes, yaar, it's a central government degree, recognized hai, equivalent to MD hai. Chalo ji. I got convinced. The next day I went to St. Stephen Hospital. 8 to 10 people were sitting. So the moment I said, they called me, I went there. They did like, look at me, look at my face. Means, kya karte ho? What do you do? Practice. Ha, 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 ha. Everybody started laughing at me. Ab isko kya aata hoga? Now, 10 people, they all, OPD kursi mein, they all sat like this. The revolving chair was there. Tu pooch yaar, one fellow, what is this? I answered. And uske baad, uski kamar seedhi ho gayi. He was sitting straight. Within 5 minutes, everybody, उनकी सबकी कमर मैंने सीधी कर दी. Now अब टेबल पे वो ऐसे बैठ गए. It was rapid fire round. Rapid fire, literally. I answered all the questions. What is WBW syndrome? I answered. How you treat a case of acute pulmonary edema? Sir, I'll give IV morphine. You asked delta wave. Everything I answered. They were surprised. They were shocked. They were amazed. They were amazed to see my knowledge. Yesterday they took interview of so many people, not a single, only they found single one. Today, anyway, now why I told you this story in detail. Knowledge never goes waste. It is a message to everyone whosoever is watching this video, maybe today, maybe after decades or whatever time it may be. Knowledge never goes waste. Your book should be your best friend, whichever specialty you are. Not only medicine, engineering, whatever profession, your book should be your best friend. Good books are the best friend. So entering into this post-graduation DNB medicine, I joined in St. Stephen Hospital. The credit goes to two persons. One is Professor Dr. G.D. Gupta, and I bow my head with the respect. He guided me, and I obeyed his advice. 9 people made laugh of him. And I also thank my dear friend, Dr. Ashok Mittal, who came all the way to tell me, and that changed the whole story. Okay, and again, just to add on to this, again, after recently, all those 9 or 10 people who made fun of Dr. G.D. Gupta that time, we all met again in a function we met. None of them remember that incident. They asked me, how could you enter into this? I told the story that he told advice to everyone. You laughed. I took as a preaching, as a lesson, and I am here. So, one more message for all the youngsters. Seniors have the experience. Youngsters have the ideas. So, always respect the experience of seniors. You learn a lot. You respect them, and you get the reward the way I got it.
That's excellent, sir. That's excellent. I would say that's one message that, highlights this session. It's a very important message.
Anyway, we entered the St. Stephen Hospital, me and Dr. Ashok Mittal, there were 2 seats. It was a total new course for them. They were all clinicians. They were not teachers. There's a huge difference between clinicians and the teachers. It was a tough time. It's a very hectic schedule was there. Very hectic. We worked for 70 to 80 or 90 hours per week we worked. Okay, workload was too much. But anyway, that was the journey we faced. And finally, we sailed the tough time. And one more thing I like to add. In our days, there was no separate exam for family medicine, DNB family medicine. A person who was doing DNB medicine could write family medicine also. So me and Ashok Patel passed DNB Family Medicine also. It's a bonus degree. So we have a DNB Family Medicine also. Okay. Anyway, we passed. I passed DNB Medicine.
Yes, sir. And sir, the next follow-up question is, we all know how a remarkable teacher you are. So at what point you felt that I can be a teacher and I should start my journey or I should teach someone?
Can I talk a little more detail about this point?
Sure, sir. 100%.
I tell you a very nice story about how I became a teacher. When I was in medical college in Maulana Azad, I was very shy, very introvert. My schooling was from boys' schools, total boys' schools. It was a co-ed, so I used to feel very hesitation in talking to girls. And you will laugh at me that I never talked to any girl in the college. Very shy. Again, a very beautiful story, which again turned my life on when we were in final years. We used to have a class on Thursday afternoon, 12 to 1. 2 students were supposed to present a surgical case. The faculty will come and they will discuss the case. Now, who will take the case? Every time you take. 4-5 weeks gone, no class happened. One day, our HOD surgery, Dr. Mendirata came. What nonsense, class is not happening. Okay, from next week, 1 to 10 will take, 2 people will take this thing class case. One will present the history, other will take the examination finding. Now again, who will take? There was no proper designation. 1 to 10, who? Again, 2-3 weeks passed. 3rd week, people were fighting, you take. My roll number was back, my name was M. It was all alphabetically. So I said, I'll take. Tule. I took the case. It was a case of lump abdomen. I presented the case. How I presented, look at me. Everybody should look very carefully. A patient, Ram Lal, a 60-year-old man. Everybody laughed. 180 students laughing at me. It was a full comedy show. Whatever mistake a student can do while presenting a case, I did. I confessed very honestly in open public forum. Every mistake I did. People laughed. After 1 hour laugh, it was told, ha, ha, ha. Today, Kapil Sharma show is very famous. Maybe after 10 years, 20 years, people will not remember Kapil Sharma, but just to inform you, it was a big laughter show. After 1 hour, I came out of the room like everybody laughing at you. How insulted you feel. I went like this. One of my friends came. Why you are depressed? All these who are laughing at you, did any one of them had the guts to present a case? None. But you did it. तो अटकता बहुत है. Okay, your flow is not good. That gentleman. Done. Next week, again I took the case. Now the case was Mr. Ram Lal, 60-year gentleman. The last was gone. Again I went to him. क्या कमी है? अब तेरे में ये this is the problem. Next week again I took the case. Okay, I removed those mistakes. Okay, it became better. Again I went to him. Okay, now I started talking to many people, senior also. Okay, my case. Now it was fixed that Mukesh Bhatia will take this class. And it was, I think, 7th class. 7, you can say, 1, 2, 3, 4, 5, 6, 7. HOD surgery was standing with me. I presented the case. It went so flawless. The moment I finished history, the HOD surgery looked at me like this. Nobody can fail him, not only in MBBS, in MS also, nobody can fail him. Okay. That was a turning point of my life. Had I dropped out in my first presentation out of depression, frustration, I would not have been there. What is the message for the youngster? People laugh at you. If you are doing a good job, carry on. Always face the criticism in a positive way. Those are your best friends who tell your mistakes. Is a message for every one of you. I don't compete with anybody. I don't compete. I say, this I've told hundreds of times. I compete with myself. Whatever I am, tomorrow I should be better. I keep on asking how I can improve my working, my thinking process, my concentration, so that I'm always busy. Okay, I grab, okay, this quality he has, I grab. This quality he has, I grab. Then I become better. Oh, the way he teaches, oh, good style. I have my own style, people like it. But I can tell very openly, this I have copied from whom. Everybody has good quality. Take it. And, array, this is bad quality. Bad, no, I will never do like this. This is a bad thing. No, I will not do like this thing. So I prevent that way also. So this was the question, how I became a teacher. Okay, then the teaching skill I developed. A shy, introvert, hesitant person, developed a style, and that really helped me in during our DNB training also. We used to speak out. Language flow is there. That came, and ultimately that really helped. Okay, that really helped to improve and to come to this stage of become a good teacher.
Sir, at what point you started believing that MD medicine I've done now, and I can definitely make a difference in people's lives, as well as I can teach students simultaneously?
Great, a great question. Well, when I passed my national board, one more thing I like to tell you. In our days, the pass percentage of DNB was only 5%. 80% will fail in theory, and other 15% they will fail in practicals. Only 5%. Now the result is much better. In our days, it was way back in 94-5 ka time tha. Only 5%. Out of 100, only 5 will pass. I still remember when my practical was there were 10 students appeared that day. Only I passed. 9 people failed. Mortality rate was so high. Okay. Anyway, uske baad I started practice. I became a consultant also in a Khosla hospital in Shalimar Bagh in Delhi. So I had a habit of teaching. So whosoever the RMO was with me, I used to teach. Then slowly, this round became very famous. All JR, they will say, sir, you come for round at 12:30 and you finish your round by whatever time. At 1 o'clock, all JR of the hospital will come to ICU, and I used to start teaching them whatever. And every JR will be there. And one of the students, there was Dr. Vikas Malhotra. So after some time, exam हुआ उसका, sir, I got MS ENT and in Maulana Azad only. And वो आपने ये पढ़ाया था, you taught this question came. 5-7 questions are good enough to turn around. And he got MS ENT. Later on, he became professor director of ENT in Maulana Azad Medical College only. So Dr. Vikas Malhotra was my first student, and I can say with a great proud. And this I have acknowledged in my book, Medicine Simplified. उसके बैक पेज में लिखा, उसके एक्नॉलेजमेंट में लिखा है, शुरू के प्रेफरेंस फर्स्ट एडिशन का जो था उसमें लिखा है, डॉक्टर विकास मल्होत्रा का नाम भी लिखा है. I have mentioned specifically this point that he was a man who really inspired. फिर I said, why not to do in a structured manner? Then I started teaching. Okay, I कुछ पैम्फलेट बांटे. Day 1 पे 2 लोग थे, don't pay me any money. Day 2 में 4 आए, 8 आए. next day में. And by the time I finished my 8th or 10th lecture, hall was full. I started the idea of integrated teaching. I told you, whenever there used to be a lecture in my practice days in Rampura, I use thyroid ka lecture, I'll read anatomy, physics, everything I used to read and go there. That time I never knew this is integrated, honestly. So I started teaching like this only, integrated way, which people liked it very much. The concept of integrated teaching was brought to me in India by me 30 years back, which Indian government has brought now. Okay. Now, but that need lot of hard work and knowledge. This cannot be done in a simplified way. That way, teachers have to update very well. Okay. So unless teachers do the hard work, they update, they cannot go for the integrated teaching. But anyway, I brought, people liked my idea. It grew. And I confess very honestly, I never did it for commercial gain. Why I started? इसी बहाने मैं भी पढ़ लूँगा. I also read. If I have to speak in front of you for 1 hour, I have to read 10 books, 10 hours. This is the universal truth for everyone. Even if you have to speak for 1 hour in front of me, 10 book, 10 hour, तो मैंने कहा इसी बहाने मैं भी पढ़ लूँगा, because you know I was very crazy about my books. I loved reading, and moreover I had a teaching skill, and due course of time you improve. I told you my aim was to talk to students, tell sir ये कमी है, इसको ठीक करो, you ठीक करो, and I became better. Better. You sharpen, you get polished. More you get polished, you more style. And now I have come to that stage. I can speak for 10 hours, and people come fresh and they go back fresh. So I know how to keep them fresh. That is style that develop in a due course of time. So this answer to your question, how I started. फिर इसको बाद शुरू में टीचर नहीं मिलते थे. I was not getting teacher. So practically every subject I taught. Even I have taught gynae also. Gynae malignancy I taught. Of course, I can't teach the normal labor by malignancy. Practically everything I taught, whatever, but integrated way. But again, repeating second time, I did it so that I can also read, because knowledge gives you self-confidence. Is a message for all of you. माँ सरस्वती की आराधना कीजिए, लक्ष्मी जी खुद चली आएंगी आपके पास. ठीक है. Normally in practice, when you enter practice, nobody reads. They are just busy earning money. बोला ठीक है, that's good. You should earn money. I never say don't earn money. But sometime of your day, a topic, small topic, you should do. And one more thing, always give some time to your health also. So we always say, दुर्गा माँ में 3 चीज़ें होती हैं. माँ सरस्वती, माँ काली, माँ लक्ष्मी. हमें इन तीनों की ही पूजा करनी है. माँ लक्ष्मी पैसे करने हैं, कमाने हैं, हार्ड वर्क करके. बी ऑनेस्ट विद योर पेशेंट्स, गॉड विल गिव यू. माँ सरस्वती, थोड़ी बहुत पढ़ाई ज़रूर कीजिए, अदरवाइज यू फॉरगेट एवरीथिंग इन कपल ऑफ ईयर. एंड माँ काली के लिए एक्सरसाइज करनी चाहिए. I don't need to talk more on this issue. Yes, unfortunately, this component is lacking in most of the medicos. So, dosto, again, one more message for all of you. माँ काली, माँ लक्ष्मी, माँ सरस्वती, इन तीनों की blessing बिना hard work के नहीं मिलती हैं. Whosoever watching this video, I pray to माँ दुर्गा कि इन सबको blessing मिले. एक और चीज़ जो भी देख रहे हैं, कभी भी देखेंगे, ब्लेसिंग रहे और याद रहे, ज़िंदगी में 3 ही काम करने हैं. माँ काली, माँ लक्ष्मी, माँ सरस्वती. इन पे फोकस कीजिए, बाकी की चीज़ों को छोड़ दीजिए. योर लाइफ विल बी ए हेवन इन दिस अर्थ.
Yes, sir. Thank you so much for this message, sir. So next segment of our podcast is called as imagination. So in this, I will give you imaginary scenario. You just have to tell me that what could be the answer to that. I would like if you can keep it either 1 word or 2-3 words, because it's just a title. So first title, if we were supposed to make biopic of your life, movie, so what title we should give to that movie?
Knowledge never goes waste.
Yes, sir. Sir, second question. If you become health education minister or just education minister of the country, what three things you will change?
First, I'll focus on the teachers. You permit me to talk a little bit more, I'll be very happy.
Yes.
Now, if I ask somebody, why an institute like us, of course, now I am there are other people are also there, why they should be there. 30 years, people of AIMS, student of Delhi AIMS, prestigious most institute, that was no other AIMS that time. Even they used to come and study with us, with me. Why? What is the problem in AIMS? They have everything what they want. But teachers are not teaching properly, whatever. I don't want to go into this. I don't want to make any controversial statement. If a student is coming to me, that means he's not getting that. Well, I'd give you one example. In a very famous medical college in Delhi, I will not name the college, HOD of biochemistry, HOD, head of department. His class is from 12 to 1. He enters the class at 12:15. He will carry a small piece of paper, go to the blackboard, write something without looking at student. He will write for half an hour and go away without looking at students. If this type of people are there as a HOD, then what do you expect from the students? Where will they go? You ask a question, if I were the education minister, yes, I'll first focus on improving the quality of teachers. Many of the people, they are just talking same old stuff, same note. They even don't update. Friends, student knowledge, it depends on teacher's knowledge. If you create one Dronacharya, he can create thousands of Arjuna. Our country does not lack in people who want to become Arjuna. They don't have Dronacharyas. So if I become the education minister, just focus. Take the test of teachers also. How do you know if he knows or doesn't know? Not only knowing a subject is there, whether he has teaching skill or not, that is additional thing. They need to be taught, trained, make them better. And if this is done, then our results will be amazing. Then student need not come to institute like us. And I'll be very happy. Imagine, but underline my word, I'll be very happy if students don't come to me. They're getting good stuff in the respected colleges. I'm very happy. And one more, before that again, the one thing I told you, the government should pay a special mention. That school and medical, any professional college, whether it is engineering or MBA, this huge gap is there. Guide a student how to cope up the stress also. And I offer my free services to Government of India also if they want, or anybody else who want to. I can give free services.
So that's all about the imagination series, sir. Finally, we have few questions for you to answer for MDs and medicine residents. So first of all, so what do you think is the end point of the medicine as a career? Like, should they do MD medicine or should they settle on the MD medicine, or DM is must? Currently, what do you think should be the approach?
Well, MD medicine is a very good branch. It's an evergreen branch. But as the trend going on, especially in the big cities like Delhi, Mumbai, Chennai, people want to go to super specialist. It's a rule. MD medicine becomes just like general medicine. Okay, of course, it has a value, I never say. But if you are settling down in any B and C tier cities, MD medicine is a good evergreen branch. Maybe after, well, it is 2025 now. 26th April is the date. 2025 is the year. Maybe down the line after 10, 15, 20 years, many of the branches may not be that important. Artificial intelligence has come. It may take over, I underline my word, it may take over radiology. MRI is done, go to this thing there, and that they will report it. Then where will the use of a radiologist? Okay, but there are few branches like medicine, pediatric, gynae, they are evergreen. Delivery is to be done by gynae wala. AI cannot do delivery. Similarly, seeing a pediatric patient or medicine, these three branches will be evergreen. Okay, others, well, the time will tell. I don't know. I'm just thinking because nowadays people do talk. And of course, I talked to this about radiologists also. Even they agreed. That's why I'm making a very bold statement. It's not a statement by me. I asked a few of my radiologist friends, yes, it may. Today, radiology is one of the topmost branches in MD. But later on, it may not be that lucrative. But it's a statement taken from somebody else. I'm just telling you, yeah.
Sir, next few questions. What advices you will give for the medicine students or medicine people to flourish in their practice? What key things that you have learned throughout your career that have you got from the influences you had? So what key things that they should keep on following?
Very good question. Okay, two things I'll tell them. How to become a good clinician and how to become a good doctor. They are two different things. Suppose whichever branch in medicine, not only medical sciences, not only medicine, especially during your postgraduate days, how you should learn the art of medical sciences. See the patient, read the book, see the patient. Suppose there's one patient with diabetes, okay. Take history, examine the patient. Suppose he has the problem of peripheral neuropathy, you examine. Then you come and read about peripheral neuropathy from any standard book. Davidson is a very good book. Okay? Maybe you can read my book also, but that's optional. But I'm saying Davidson. Again, see the patient. Then two friends, you discuss with your friends. Then you become wiser. Okay, I have seen this case. Suppose there's one case of pleural effusion. Go examine the patient, read the book, again examine, and your topic is over. 3-year residency, 365 days, let's say 300 days. 300 days, 3 years, 900 days. If you read one small topic a day, then your whole medicine will be in your fingertips. Now you have seen the cases also. In the exam, they talk practical thing only. So in this way, you become a better clinician. Your skill increases. New drug has come, you read about that. So half an hour per day is good enough to maintain your clinical knowledge even during your hectic practice also. Now this was again clinician, now doctor, now you are going to ask me, what is the difference? They are same. No, they are not same. Clinician is your own skill. Doctor is how you are treating a patient. Be honest with your patients. Repeating second time, be honest with your patient. Don't carried away by the pharma company or laboratory wala, blah, blah, blah. I don't want to talk more on this thing. They may give you, will give you this, will give you, no. When I write a medication, any molecule, ABC I have to write. And one ABC molecule is made by 10 companies. But I write that molecule which has the lowest rate in the market. I know this molecule I'm writing is a good, of course, good brand, good company, not a local company. Good brand, 1 rupee, other is 10 rupees. I know it's a 10 times more expensive. And that 10 wala company wala is offering me, we'll give you this, we'll give you that. I don't want nonsense. I write 1 rupee. So I am indirectly helping my patient. Okay, give honest answer. Even laboratory wala, I'll write all my prescription. You can see any of my prescription. Give maximum discount to my patient. I don't need to talk more about this thing. In that way, what you develop, many people will not like it. Kya yaar, what is the old-fashioned man? No, it's evergreen. When you are honest with your patients, okay, they develop trust in you. People say the greatest thing in the earth is love, but more than love is trust. You may love 100 people, but you can't trust everybody. You cannot discuss your personal problem with every Tom, Dick, and Jerry. Only the one who you trust. Medical profession is based on trust. You would develop the trust of the patient, and then sky is the limit. For everything, they may go to any XYZ doctor, hospital, they will finally come to you. What is your opinion? Because they know he is the right man, he will give an honest answer. Always be honest. It has a little more incubation period, but it is an evergreen, permanent success gateways there.
Yes, sir. Thank you so much for that amazing answer, sir. So, final segment of the discussion now. I will ask you few random questions. Will be rapid fire. If you like it, you can just say I like or not, or you can just say pass. All right. So the first question, sir. Who is your favorite Bollywood actor?
Bollywood actor Dilip Kumar.
Okay. So which is your favorite movie?
I love all comedies.
Okay, sir.
Okay. Rather, if you ask Bollywood, if you have asked anyone, that I would have Charlie Chaplin.
Okay,
I
sir.
still love to see Charlie Chaplin. So,
Third, sir. Who is your favorite singer?
Singer, Hemant Kumar.
Wonderful, sir.
Even I also sing.
Sir, can you please?
Pakka.
Yes, sir. Sure. I would also accompany you.
Okay, just listen to me.
Yes, sir.
ये जाम भरे भरे, ये जाम भरे भरे, जरा पीने दो, कल की किस को खबर, एक रात होके निडर, मुझे जीने दो, कल की किस को खबर.
Wow, sir, amazing. Your voice is amazing. It's brilliant, sir. Brilliant. Sir, next question in the rapid fire round. That have you met any celebrity, per se, any actor or any singer, which you like by choice?
Well, अभी तक तो किससे मुलाकात नहीं हुई है, but why to meet somebody else? Yes. Why don't you yourself become a celebrity? ऐसे बनो कि लोग आपसे मिलने आए ना. So this is a message for all the people who are watching. Work hard in your life. और कुछ बन के दिखाओ, लोग आपसे मिलने आए. तो you, मैंने पहले कहा था, always compete with yourself. Become a celebrity yourself.
That's so important and so nice message, sir. So nice. So last question, sir. Now, if you were at my age now, at 30 years, what message you will give to all the viewers who are watching us and want to learn from you in the nutshell or in the highlight? That these three things.
In nutshell, there is no shortcut to hard work. Number one. Whosoever you find a successful man, you read the story of the struggle, how they really worked hard. Like in my story also, I told you I got so many failures. People laughed at me when I presented the case, but I never backed out. Had I backed out, I would not have been at this pace. People do criticize. People only love to go for success. This is the story, hard work. And blessing of the Ma Durga, three things you should always do. Leave aside all these things. Live a focused life. Okay, Ma Kali, Ma Lakshmi, Ma Saraswati. And before you close, my Ish Dev is Ganpati ji. In fact, if you see DBMCI, I always say he's the owner of DBMCI. And now when I made a new company, DBA, Dr. Bhatia Academy, now in the logo also, Ganpati ji is there. I always say, I am the employee of Ganpati ji. He is the owner. I am his employee. And believe me, in 30 years of my career, n number of problems and difficulties I faced. To tomorrow, in the morning, something is to be done. In the evening, I don't have any solution. I'm just sitting like this. Suddenly, a solution comes. Why? My boss knows that my employee, senior most employee, of course, is pareshan hai. He's upset. He come with a solution. That is the intense faith I have. Remember, have faith in God, whichever you believe. But have confidence in yourself. Your self-confidence and your faith in whichever, I don't say this, that, every God is equal. Okay. I have Ganpati ji, I still, but everybody has different. Have faith in your God, but have self-confidence. Sky is the limit of success.
Thank you so much. Thank you so much, sir, for such a great discussion on this. And I'm so overwhelmed with all the experiences you just shared with us. It's, I think, rather than just a podcast, it's a life lesson for all of the viewers as well as for me as well. And it completely took out a different personality of myself when I listen to you. So it's a huge honor to have you on this podcast. Thank you so much, guys, for connecting with us, watching this entire video. I hope you also loved this. Please let us know in the comment section which part of this podcast you loved the most. And if you have any questions, you can ask sir in the comment section. I will forward him, or you can just directly message me as well. And yes, finally, please share this video with your friends and family, because this is moreover an educational as well as a family show. And finally, subscribe to my channel for more such content. Thank you so much.
May Ganpati ji bless all of you. Thank you very much for inviting me to this show. Thank you very much.
Thank you so much, sir. Thank you so much.